Hi, this is Chandramouli, kidney health coach. I have been working since 15 years as a wellness coach, treating lifestyle diseases like diabetes, hypertension, metabolic syndromes, hormonal imbalance, muscle and bone pain, joint related issues, autoimmune disorders, utilizing non pharmacological interventions. Naturopathic, nutritional, and dietary management is the key secret to heal your problems. Today, I am going to explain about the rare and very painful and pathetic disease called ADPKD, polycystic kidney disease. Polycystic kidney disease, why I am calling it as a pain and pathetic. It is pathetic because if anybody get diabetic neuropathy, diabetic nephropathy, diabetic nephritis, that fellow suffer. But if somebody get ADPKD, if he is a first generation ADPKD patient, his genes will transform to the next generation, generations to generations. So it is a genetically modified CKD, which is also called as ADPKD, autosomal dominant polycystic kidney disease. This is a disease which originated due to the imbalance in your digestive system, and it will leads to cellular damage and genetic modifications, which causes transformation of genes from one generation to another generation. That is why this is a pathetic disease, where it goes to generation, from parents to children, and it is very painful. Usually the kidney is as size as our fist, but it grows into a volleyball size, so which causes too much pain. So that's why it is a painful and pathetic disease comparatively other CKD, non-genetic CKD diseases. Understanding chronic kidney disease through the lens of evolutionary biology highlight the mismatch between our Paleolithic optimized genes and modern diets. Ancient diets, we have to compare ancient diets with the modern diets, which led the dramatically increased prevalence of CKD in the modern society. In particular, the at present standard modern diets are high in carbohydrates, processed foods, ultra processed foods, refined foods, causes conditions like type 2 diabetes, metabolic syndromes, chronic inflammation, and hypertension, leading to CKD. Autosomal dominant polycystic kidney disease is a genetic form of CKD, is characterized by progression of renal cystogenesis, where the particular patient develops cysts around the kidneys, which are painful and cause inflammation and make death of the kidney and decrease GFR levels. This cystogenesis process leads to renal failure. The real challenge, the fantastic view of ADPKD is solely a genetic disease, because first generation ADPKD patients modified into a genetic problem. Usually we argue that just like non-genetic CKD, modern dietary practices, lifestyle and environmental exposures like pollution accelerates ADPKD progression. So evidence already there are research evidence shows that carbohydrates, overconsumption of hyperglycemic foods, and insulin resistance, hyperglycemia significantly impact renal health. Additionally, the factors like dehydration, electrolyte imbalance, nephrotoxins, nephrotoxins exposure, gastrointestinal dysbiosis, microbiome dysbiosis, and renal microcrystal formations like kidney stones, uric acid stones, calcium oxalate stones, calcium phosphate stones exacerbate ADPKD, autosomal dominant polycystic kidney disease. Conversely, carbohydrate restriction, ketogenic metabolic therapies, and antagonizing the lithogenic risk factors promise the slowing or decreasing the growth of ADPKD issue. Progression, addressing the disease root cause, and identifying the triggers through dietary modification and lifestyle changes offers a conservative non-pharmacological strategy for disease mitigation and modification in ADPKD progression. So there are research papers which showing that urgency of integrated diet and lifestyle factors into the along with clinical practices. of ADPKD mitigate disease progression and improve patients' outcomes and offers therapeutic choices. And that can be implemented worldwide with no cost and low cost healthcare measures. So that is what we are going to discuss here today. So please watch a research paper which I am displaying on the screen so that you get some idea. Trigger warnings: how modern diet, lifestyle, and environment pull the triggers on the autosomal dominant polycystic kidney disease progression. So usually we think that it is a genetic disease. So we neglect that it is a we cannot stop. But the main triggers or stimulants are the environmental factors. So see how does the kidney transformed. A normal kidney, when it progressed or PKD mutations, gene mutations initiated with the help of triggers, PKD mutations will cause renal injury by producing lot of cysts around the kidneys. And you can see there is a research paper, you can see clear picture how do ADPKD initiated in our bodies. Okay, see oxalate related foods which cause ADPKD progression, and ultra processed foods, carbohydrates, sugars, starches, sucrose, fructose, refined carbohydrates, high glycemic load foods, fruits, starchy vegetables and grains are the triggers for the ADPKD disease. So oxalates and processed foods also procure phosphates, especially inorganic phosphates. And if you take protein, animal protein, too much animal protein, it will also promote some uric acid in your body through purine metabolism. And if you take refined carbohydrate, in turn it will also cause uric acid production. So when you take processed or packaged food, it also increases sodium intake in your body, where it leads to hypertension and hyperglycemia due to the carbohydrate rich foods, hyperinsulinemia and insulin resistance due to the resistance and overconsumption of carbohydrate rich food. This leads preparation in the body, especially in the tubules of the kidney, nephron tubules, renal crystal formation. So this leads inflammation and renal injury, formation of cysts. And there are other comorbidities which helps progression of the disease like overweight, obesity, metabolic syndromes, type 2 diabetes can damage our body very quickly. So there are some other medications like non-steroidal anti-inflammatory drugs, proton pump inhibitors. These type of toxins also cause urinary tract and kidney infections. So that is why in ADPKD the first symptom is like stone formation or urinary tract infections. So usually when you get a lot of stones, small stones, if you go to the physician, he will say there are a lot of stones are there, you have to drink a lot of water, it will be resolved. But we have to find out the root cause, or otherwise it will damage your kidneys completely. And moreover, the important thing which we have to discuss is gut dysbiosis. So our body is made up of 36 trillion cells. More than that, 39 trillions bacteria are living inside our body. So we are a lump of bacteria. So gut dysbiosis due to lifestyle and food habits, we lose healthy bacteria. So it will cause damage of our intestinal tight junctions, where through that junctions undigested particles, proteins, foreign bodies directly enter into the bloodstream, which will later cause cellular damage, mitochondrial dysfunction and genetic mutations, which will obviously generate ADPKD in the first generation, and it goes on to the next generation through your genes. So this is overall picture in the research you can see. So cystogenesis, disease progression, which will cause pain and discomfort to the patient. Please carefully watch this research paper which I have collected. So usually you can observe our kidney is built up of a small filters. That filters are called as nephrons. They have tubules. In that tubules, the renal tubule, we call them as a renal tubule. So they are unobstructed and fluid flows through the tubules. When there is a ADPKD background, Formation of microcrystals because of calcium oxalates, calcium phosphates, uric acid, and other causes. These microcrystals, renal microcrystals, obstruct the fluid flow. It will cause for cell injury, especially renal cells, nephron injury, glomerulus injury, and it will also activate inflammatory pathways like mTOR, STAT3 pathways. So this inflammation will lead damage of that tubules where the canal or the tubule inside volume dilates. So that is called tubule dilation. So crystal clearance, restoration of fluid flow will happen. But what happens? Because in the ADPKD patient, the tubules are dilated, which will cause persistent activation of signaling pathways, inability to restore tubule diameter. It will lead to cystogenesis, formation of cysts, balloon-like structures around the kidney. This is the chronic inflammation which ultimately completely damages kidneys of a human. So, how we can get out of this? It is a typical problem where it's not at all like a non-genetic CKD, like diabetic CKD, diabetic nephropathy. So we need a complete holistic protocol: herbs, dietary changes, nutrition supplements, and lifestyle changes. So diet dependent host metabolites shapes the gut microbiota to protect the autoimmunity. So gut microbiome is the essential component to mitigate ADPKD disease. So you have to restructure and reform healthy bacteria in your gut so that it will repair the tight junctions in your intestine barrier. So it will stop formation of over foreign pathogenic protein in your body. And another thing is that you have to restrict carbohydrate diet. Instead of depending glycolysis, we have to depend on the other fluid factors like ketones, estones, beta hydroxybutyrate. So if you give your body ketogenic diet, so it will repair intestinal epithelial cells. So leaky gut will be repaired, and obviously ketogenic diet produce beta hydroxybutyrate where it will feed gut microbiome like lactobacillus acidophilus. It will induce some protective factors to stop the progression of the disease. So this is the very simple thing you have to do to reframe your gut dysbiosis and improve your digestion. It's not like digestion means you have some issue, but internally it is going on. And go to the ketogenic diet. Restrict high glycemic foods or refined carbohydrates and processed foods, and intake whole food plant based diet, where I have been practicing plant focused alkaline ketogenic diet, where we give plant based food but low glycemic foods, and that plant related diet which increases alkalinity in the body, where if the human body, if the urinary system urine pH decreases, so acid pH levels decreases, it will cause citrate loss, hypercitraluria. So ultimately it will leads for acidosis. Metabolic acidosis again leads to further kidney damage. So we have to give alkaline based diet, and it should be ketogenic diet, healthy keto. But whenever we think about ketogenic diet, we think about protein. If you take too much protein, the protein metabolism which produces purines, and it will ultimately release uric acid, where your kidney is not capable to eliminate the uric acid, urea, blood urea nitrogen. So we have to restrict animal protein, we have to include plant based protein. So these are the things we have to implement, and we have to completely remove oxalates from our food, where there is a crystallization metabolism in our kidneys. So especially in the ADPKD disease, we have to remove oxalates, and hydration is very essential. Along with that, we have to restrict inorganic phosphates. Wherever from the, you have to read the labels, you have to restrict inorganic phosphates. So these are the things we have to implement so that you can decrease the progress of ADPKD, and you can stop yourself getting into the dialysis process. So this is the dietary methodology you can take. And another thing is that you have to stop the inflammation already initiated in your kidneys. For that, we can take herbs, especially in India, whether it is Ayurveda, Siddha, Unani, homeopathy, traditional Chinese medicine, Tibetan medicine, they all use herbs. We have abundant of herbs. For that, I have um, uploaded a book called Forest Herbs Kidney Tea in the Telegram channel called GOMATA Nutrition and Health Education. Just install Telegram app, go there and type GOMATA Nutrition and Health Education channel. You subscribe the channel and then you go there in the files you search Forest Herbs Kidney Tea. There I have given detailed information regarding the herbs which are useful for the kidneys and improve the filtration and repair the urinary tract system. Okay, so in that, along with that book, there is another book which I uploaded, like kidney oxalates. So kidney oxalates, you have to control oxalates. For that I have given complete list, so that also you can download from the Telegram channel. Again, there is another book, uh, kidney doc English and Telugu. So all the books are in bilingual Telugu and English. So kidney doc English and Telugu, there I have given sample meal plan and dietary protocol, which foods you can include, which foods you can eliminate. So all those things I have given there. So please go through all the books, please follow my all social media platforms, so that I give updated information, recent research developments or any improvements. I will update you through this all social media platforms. So you please go through all the books which are free of cost, you can download and use it, so that you can improve your health status. Thank you very much.